Welcome everyone to the LungCAN Bookmark project. And it's really about collaboration and raising awareness on radon. And our goal is to have this replicated in every state. We would love to see every library and every state have these opportunities to raise awareness about radon and collaborate with organizations. So first, I would like to introduce our panel today. And my name's Lauren Sant. I'm the Executive Director of the Caring Ambassadors Program. And with us today, we have Rachel Sanford. And Rachel is a licensed clinical social worker and a certified tobacco treatment specialist. And she's worked for the American Lung Association for over 8 years since starting as an intern in 2018. And then we have Allison Thornton, who serves as the Executive Director for Lung Cancer Connection and leads the Missouri Lung Cancer Coalition. Allison became involved with Lung Cancer Connection after her sister, a non-smoker and now a 17-year survivor, was diagnosed with stage 3 non-small cell lung cancer. Through this experience, she learned of the significant stigma, lack of understanding of risks, and limited resources available for lung cancer patients. Her work focuses on raising awareness and bringing together stakeholders across Missouri to focus on lung cancer prevention, early detection, and survivorship. And I want to give a big shout out and thank you to both Allison and Rachel for helping put all these materials together for everyone. Our next speaker is Mackenzie White. Mackenzie has an MPH and is the Executive Director of End Lung Cancer Now at the Indiana University Simon Comprehensive Cancer Center. She leads statewide efforts to advance prevention, early detection, and advocacy, including launching Indiana's first lung mobile screening program in partnership with Indiana University Health. A recognized leader in public health and nonprofit strategy, she was named to the Indianapolis Business Journal 40 Under 40 class of 2026. Congratulations. And she holds both her BS and MPH from Indiana University. And Heidi Naffman-Anda is a health educator and physical fitness professional, a late-stage lung cancer survivor for over 7.5 years. Her diagnosis, she learned that her home she raised her family in for more than 20 years had high levels of radon. She's a co-founder of the White Ribbon Project with her husband, Pierre, a primary care physician, to raise awareness and change how people understand lung cancer. And we have Jackie Nixon. Jackie is the president of Citizens for Radioactive Radon Reduction, or CR3, and a publisher of the CR3 News magazine. She's a stage 1A lung cancer survivor and a lifelong non-smoker diagnosed in 2015 without symptoms, later discovering elevated radon levels in her building. Over the past decade, Jackie has become a national leader in radon advocacy. Jackie remains dedicated to advancing awareness, prevention, testing, and early detection to reduce radon lung cancer risks. And last but not least, we have Dusty Donaldson. Dusty is a 20-year lung cancer survivor, founder of Live Lung, and co-author of the book, The ABCs of Lung Cancer for Patients and Advocates. Prior to her diagnosis, she was a journalist and a public relations professional with undergraduate and graduate degrees in journalism. So welcome to all our speakers. We're going to start off with Rachel to get us going. So thank you.
Thanks, Lauren. All right. So as I'm sure many of you are aware, radon is one of the leading causes of lung cancer, but many people have never heard of it. So there really is a critical awareness gap when it comes to radon education. As far as understanding radon, radon is a radioactive class A carcinogen, meaning there's enough evidence to prove that it causes cancer, produced by the decay of uranium, which is found in soils and rocks throughout the world. Radon is colorless, tasteless, and odorless, so there is no way to detect it aside from testing your home or building. When inhaled, radon particles become trapped in your lungs, and over time, those particles break down, damage the lung and the tissue, and alter the DNA of the cells. Radon can enter new and old buildings through cracks and openings in floors and walls, and can accumulate to dangerously high levels. There's a lot of misconceptions around the fact that, a lot of people think that radon is only in old buildings and homes that are falling apart. But with the new buildings and the construction standards that are a lot more strict than they used to be, new homes and buildings can actually trap radon even more than those older homes and buildings. So it's not about the age or location or exterior type or foundation or any of those aspects that determine if a building has high radon levels. And as far as radon by the numbers, radon is responsible for about 21,000 deaths every year in the US. It is the second leading cause of lung cancer overall, and the number one cause among people who have never smoked. So there are a large number of lung cancer cases that can really be attributed to the presence of radon in the home or building where somebody lives or works. And there's also a 10 times higher risk for smokers. So prolonged radon exposure that is combined with smoking creates this tenfold increase of lung cancer risk. And this increases further depending on how much somebody is smoking and a number of other factors as well. So increasing radon awareness is such an important strategy for lung cancer prevention. And as far as why states should address radon, there are a ton of different reasons. Many of our states have, 1 in 2 homes or 1 in 3 homes with high radon levels. So the prevalence alone and the connection to lung cancer is enough cause for concern. We have, again, high radon levels in homes and buildings across the nation. There's really limited public awareness. So I've been with the Lung Association for close to a decade here, and when I started and now, there are so many folks that I have conversations with out in the community that, I bring up radon and they're like, what's that? I've never heard of it. And I had never heard of it until I started working here 8 years ago. So there is just so much lack of awareness among the public when it comes to radon. There are a ton of opportunities to integrate radon education into lung cancer prevention efforts. So whether that is lung cancer screening or treatment or survivorship, there are really just a ton of different opportunities where we can provide this information as really a frontline defense to lung cancer development. And then one of the other issues that we see is there's also a lack of legislative controls requiring things like certification of radon professionals who perform radon testing and mitigation, which can be really tricky because this is a situation where we want the people coming into our homes to address this problem to really be well versed in what they're doing. You wouldn't want somebody who doesn't have their medical license to be doing a medical procedure that requires licensure, things like that. So kind of think about it the same way. We really want to make sure that the folks who are doing such important work out in the community are certified, they've been trained, and they're prepared to do the work. And some additional reasons of why states should address radon education efforts and radon reduction efforts really align with broader state cancer prevention goals for lung cancer prevention, state cancer control plans, public health priorities, environmental health initiatives. Again, those legislative controls that we talked about for licensing a qualified workforce and community outreach. So once again, increasing that radon awareness is really an important step towards reducing lung cancer risk. And when it comes to the Bookmark project, one partner that we have utilized across different projects are libraries. Libraries offer a really unique opportunity to distribute public health information at a larger scale. They're present in nearly every county and serve diverse populations. Libraries are really viewed as neutral, reliable centers of information. A lot of libraries are aware of resources in the community, different efforts going on. So they are really a great place for folks to get connected to a ton of different information. With this kind of ready-made infrastructure for material distribution and having an established network, a lot of the libraries, operate in branches and, different regions of the states that we all live in. So they really are well poised for being involved in this work. And they have constant engagement with parents, seniors, students, high traffic, as well as a captive audience. So partnering with libraries really makes sense when it comes to these bookmark projects. And throughout the panel, you'll hear a lot more from all of our panelists about that work. And so again, bookmarks are really a great solution to that critical awareness gap and that lack of public information because they are such a simple, scalable approach to radon awareness. You can see some of the examples from our organizations here on the screen. They have very basic information that talks about, how many homes and buildings are impacted? How do you test your home? What do you do if you have a high level of radon? So it really walks the folks who are reading those bookmarks through, the most important information that they need in order to be educated and prepared to deal with this. And those bookmarks are distributed through the libraries as well as supported by webinars and digital outreach. Our program in Missouri, we've been doing an annual webinar that you'll hear more about, as well as digital outreach, including social media and awareness campaigns. And again, these are really effective because it is inexpensive, it's scalable and engaging. When it comes to developing a bookmark project, because again, this is something that has already been replicated among several states, and we really hope could be a model that additional states could use as well. But you can have several of these components. You can kind of pick and choose what works best for you. But some of those options include the bookmark campaign, distributing those through libraries. We've also worked with public health agencies, other health partners throughout the state, educational webinars that are another opportunity for public and partner education programs. Also a great opportunity to highlight personal stories of individuals who have really been directly impacted by radon and lung cancer because we can provide the statistics and the facts all day, but until you have that personal story that really hits home, it's just not always going to have that same effect on the folks that you are trying to communicate that message of, this is a critical public health issue that we all need to be concerned about. And then you can also do a combined approach. So doing the bookmarks as well as the educational webinars for expanded outreach. During the panel, you'll also hear a lot of our programs talk about how we have done things over the years and really grown and developed things. But it's important that when you're starting this out, you start with realistic first year goals that from there you can really build and expand upon. As far as recommended implementation steps, this is kind of a quick summary of how you can develop this program in your state. So understanding your state landscape is so important. Understanding the policies that may or may not be in place, understanding the impact of radon, understanding the impact of lung cancer. All of those are going to be really essential pieces in building that foundation to your project. You want to build a collaborative partnership team. So the Missouri Lung Cancer Coalition, which again is one of the programs that started this bookmark project, we have all sorts of different folks from different sectors, and we have, radon testing and mitigation professionals that we work with. We have state radon program representatives. We have folks from organizations like the Lung Association. So it's really essential that you build that collaborative partnership team. You want to connect and partner with libraries. Again, just such a great resource in making sure that this is a very easily scalable distribution, and they really have that infrastructure in place to already support that. As far as developing educational materials, you really want to be intentional about the audience that you're speaking to and what's going to resonate with them. And that takes a lot of time and careful consideration and kind of trying some things out and seeing how the community reacts and then adjusting from there and continuing to improve the products that you are putting out to the public. Printing and distributing the bookmarks is obviously an important piece of implementation. Several of us work with local printers as well as distribute bookmarks ourselves or by partnering with the distribution systems that are present in libraries or other public health agencies, launching educational webinars. So a lot of pieces that go with that, making sure that you have a good run of show. We generally have a short overview of radon, so it's not a ton of, lecture and talking at people, and then a panel that the questions that we use are based on the common questions that we have received over the years from our attendees. So really focusing on what is important and top of mind to the folks that you are, presenting to and targeting with your outreach, as well as making sure to, again, recruit those individuals that have personal stories of impact, because that really might be the piece that makes a difference in moving someone from, okay, I'm just kind of thinking about testing my home. I've heard that it's dangerous, but I don't really know, what that impact looks like in real life. So showing them, how that looks can just be that missing piece to really move them towards taking action. Tracking your program impact, which is something that we've kind of learned as we've gone along, and hopefully you can learn from some of our, mistakes and early lessons of how we've kind of stumbled through tracking our program impact and making sure that we are, reporting on very important outcomes and looking at what has been the most impactful for the folks who have interacted with our educational campaigns. And then expanding the program. So using everything, again, that you've learned from kind of those first 1 or 2 years while you're getting your footing to continue to make those improvements throughout. And, the main thing that we want to stress here is that a lot of these start as small ideas, but a small idea can easily become a statewide collaboration. And so this is just an example of how the model has expanded, specifically looking at the work in Missouri. The model was simple and effective, and a lot of states adapted a similar outreach approach because of that scalability and that ease of implementation. And other states have implemented different radon outreach strategies depending on, what works best for them as well as the population that they're serving. So states implementing a radon bookmark model include Colorado, Indiana, and Missouri, and you'll get a chance to hear from panelists in all of those states today. And then states implementing other radon outreach models include Maine, North Carolina, and Pennsylvania. And as far as looking at the results in Missouri specifically, in the last handful of years here, we have distributed over 110,000 bookmarks. We have hundreds of participants that have joined our webinars over the years, really consistent growth since we started in 2022, strong statewide partnerships. And again, our main goal as we've kind of walked through this work ourselves is to really make sure that we have a model that can be easily replicated by other states. So now that you have a little bit more background, I will pass it back to Lauren.
Thank you, Rachel. Mackenzie, we've heard a bunch about Missouri. I'm going to pick on you for a few minutes. Do you want to tell us how you got started and
Sure.
tell us a little bit about your program?
Yeah, I would love to. So, In Lung Cancer Now is an initiative at the IU Simon Comprehensive Cancer Center in Indianapolis. We're focused statewide, but we really work through collaborations and partnerships. So, when it came to our Radon Bookmark program, really the idea came from Heidi after implementing something similar in Colorado. Heidi and the White Ribbon Project are represented on our advisory board. So, Heidi brought this idea to us as we were talking as a group about how we can focus more in the area of prevention and risk reduction for this year. And so from there, we met with Heidi, learned what they did in Colorado, and we quickly, and this is one of the things that was most surprising to me throughout this process, is how quickly we were able to pull together our partners. So someone from our state Department of Health in the radon area, a representative from our local American Lung Association chapter, and actually someone from the State Library Association was involved in this initial meeting talking about this idea and the goals. And so that really, to answer the most surprising question, that is what was most surprising to me. is how quickly we were able to get buy-in from partners who shared the same goals of reducing radon in our state. Fortunately, In Lung Cancer Now already had some money set aside and budgeted for prevention initiatives, and so this fell into that category. It was relatively inexpensive to implement. One of the partnerships that I would say played the most critical role and helped reduce or offset costs was our library association. Logistically speaking, it felt a little overwhelming at first thinking through how we were going to get bookmarks out to all of our public libraries across the state. I think we have 230, specifically, if I remember correctly, but partnering with the Library Association made it very easy for distribution. They have a courier system, and so we essentially just had to ship and distribute to their central office, and then they shipped the bookmarks out to all 230 libraries for free. We didn't have to pay them to do that, and so that was something essential, I think, to helping manage the cost and also manage the logistics of something that could be a little complicated if we did not have that partnership. In terms of outreach strategies, we haven't done any webinars in tandem with our bookmark outreach. So the main component was getting the bookmarks to our public libraries, but then we also tried kind of a social media challenge component to this. And so once we knew that the bookmarks had been distributed, we utilized emails and did some email campaigns around promoting this bookmark challenge, so to speak. So we encouraged everyone who was on our email list to go to their local library, take a selfie with the bookmark, and post on their own social media. We gave them some captions to use, and then we also asked them to send those selfies to us so then we could do kind of a collage of selfies. And so that was something that we tried to do fun, and then trying to get the word out farther than our own network by people posting on their personal social media. So that was something fun that we implemented. I think next for us in terms of outreach, we would like to add some webinar components. In our initial conversations with the key partners, the Department of Health and the libraries and the ALA, we did talk about the idea of if this goes well, potentially we could focus in some higher radon areas in our state and do some learning in partnership with that local library, whether it's an in-person component where the community could come or some sort of webinar. So that's something that we are hoping to do in the near future, but have not done yet. So overall, it's been a very successful, wonderful program. We've been able to also take these bookmarks. We printed extra and take them out into the community to community events, have them at our booths, and they've been really honestly popular. I would say that the ALA has been an integral piece of this. That's where we push people to order the radon test kits. They have the most affordable ones. So that has been something huge for us as well. But one thing I would like to mention is kind of a lesson learned or a challenge that we had that we didn't really know to anticipate. And so partnering with the Library Association, again, was very integral to our project. But what we didn't do in advance of all of the bookmarks getting shipped and distributed through their courier system was do individual outreach to the individual libraries. And so in some instances, after we send out an email campaign telling people to go to their local library to take a selfie, we did get some emails like, we can't find these, no one knows what we're talking about. And so what happened is without that individual outreach or direct communication to each library, in some instances, they were very unsure of like what this box was for, what to do with it, even though we did include a letter in the shipping trying to kind of reiterate what it was for. In some instances, these bookmarks did end up in the recycle bin. And some libraries have rules that they can't put up external kind of promotions or educational things. And so I think that's the biggest lessons learned for us is, yes, these partnerships, statewide partnerships, are essential, but that direct outreach and communication and collaboration with each local library was probably something important for us to do, and so we will do that in the future. But overall, I would say it was great success. It's been fun kind of tracking how many times these QR codes are getting scanned, and so I think also for us in the future would like to kind of take the evaluation of is this successful a step further and see if we can somehow track actually how many radon test kits were ordered. I don't know how we would do that, but that's something else that we've also talked about doing.
Great, thank you. Well, Heidi, you got called out, so I'm gonna call on you next.
I got introduced to this program through Allison, who had outreached me several years ago to be the patient voice on the webinars. And when I learned more about the bookmark, I thought, gosh, this is, a great idea. It's ingenious, actually. Why isn't this being done, everywhere else? And after speaking with her, and also I've had a pretty close relationship. I hope everybody does, anyone who's interested in advocacy or getting involved. And if this is of interest, is to get involved with your state cancer control coalition. Every state has one. Not every cancer coalition has a lung cancer task force, though. So Colorado does. And so I had started working with them a few years ago. And, you get on these calls, once a month, and you have all these key, decision makers from the state on there about what they're going to do. And so, you have your foot in the door there and especially can challenge them because we know this is a state prevention goal for every state is to, try to prevent lung cancer. And most people don't even know about radon, and a lot of people on those coalitions don't know much about it either. So here's an opportunity for growth. And exactly like what Mackenzie said was, so I had this relationship with the Colorado Department of State of Health, Public Health and Environment already on their lung cancer task force. So when I mentioned this to them, they really wanted to invite Allison to a call and speak to, how this whole thing worked. And they were very excited afterwards because they were getting the information you're getting today, as well as in-depth information about the webinar and how to maybe not recreate the wheel with a webinar, but join their webinar. And we were able to do that with a great, team that, Allison's been working with for years out of Missouri. And so we had this collaborative webinar. There was interest. The Colorado Department of Health was very willing to fund the bookmarks. And so that wasn't the same in other states, but there's usually someone who's willing to do it or could chip in on it. It's not a huge cost. Again, start small and get those bookmarks out. Again, we were able to establish that in Colorado. We also got the library system on the call. And again, it's like Mackenzie was saying, it was just so easy. It was like, oh my gosh, this was like one call and everybody's on board and wants to do it. Established for us a concern was how were we going to distribute these? And they have a courier system. So it was get them printed, sent them to one central location where they then distributed them. But like Mackenzie said, it's like we do need to do better about outreaching the individual libraries or a region or something because some libraries just had them sitting in the back room. They didn't know what to do with it, where others ran with it and did displays and, they were up. Another thing we do in Colorado is they do have in October, which is actually Radon Awareness Month, and January is Radon Action Month. In October, they have asked us to come for like the past 4 years to come on up to one of their central libraries and do a talk on radon. And, I'm the patient story, but then we have radon professional, and we also have someone from the Colorado Department of Public Health and Environment there. You're getting the information out there through trusted sources. When we go up, and I think other organizations need to look at this as well, if you want to put your logo on these bookmarks, especially if you're funding them, think hard about getting some other trusted sources logos on there because they may not know what the White Ribbon Project is or what other organizations are. But if you have the Department of Health's logo on there, you have American Lung Association or American Cancer Society, whoever you can get to partner with you, I think those are really important resources to show the public that this isn't just something that they now need to vet more because they didn't hear of this organization before. So, yeah, that's how we did it in Colorado. And Mackenzie did a great job in Indiana. And now, gosh, can we spread this across the country? Because we know there's some more, radon activity for sure that Jackie has spearheaded for many years. So, I'm guessing Pennsylvania, will be easy to get this on board. And how quickly can we get this everywhere?
All right. Well, thank you, Heidi. Jackie, you got called out. I think you're next.
Well, I thank you for that. And this has been very interesting, by the way. And I wanted to say that the bookmarks that we have, all right, are an extension of a whole entire project that we started back during COVID. At the point where people couldn't go out, your kids were learning from home with and I'm in the radon industry, so the question became, oh my God, how are we going to do more testing and whatnot when people aren't there and da 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 da. I mean, it was just like more or less business. And I was sitting there talking to our founder one day, and I said, you know what? I said, where are these kids? And we said, all right, they're at home. Where are a lot of the places they're studying? They're studying in the family rooms, which may be in the basement. And where do we find the radon? So I don't see COVID as a deterrent. I saw COVID as actually some way to encourage more testing. And as we went along, what we did was we actually started promoting the fact that got more kids at home, you need to address this. Now, the other part of that is this. As we go along in this radon industry, we're getting older, and we're going to retire one day and enjoy our grandkids like Heidi and Pierre are doing. And so bottom line is that we're going to have somebody to take over. So we should be looking at the youth. And I think that's very, very key to whatever you're doing when it comes to promoting radon. Always think about the young people because they are going to be the leaders of tomorrow. And there was so much going on with climate change. And I also was thinking about the fact that they're going to feel that if you don't give them any kind of, let's say, encouragement or any kind of control over their own lives, bottom line is they're going to think there's nothing they can do about this radon issue. Why should I try? So we need to educate the youth, give them some tools that they can work with. So what we did as a major project is we actually created those bookmarks, but that was alongside the CRCPD calendar that we had, school calendar. We said, let's address the schools, let's address the classrooms as a STEM project or just, a learning tool, something fun for them. So we did the calendar, and then out of that came the bookmark, of course, that went with it. They match actually, literally. And and I had a young person help me do this. And as we were designing it and whatnot, he said, you know what? These kids need superheroes, not we. The kids, they want something fun and, radon science is dry. Let's just face that, okay? You got to make it fun for them. So we did. We created superheroes. And we created these superheroes, which you saw in the bookmark, and they each had ecological names like Eco and Gator for mitigator, Curie. Well, we know who that is, Madame Curie. And then each one of those had meaning. So in the back of the calendar, you could tell what their superpower was. Each one of them had a superpower. Then after we did that, then we had said, the person that was telling me this, he said, well, you got to have a villain. So then we created Thoron. And Thoron basically is the mother of uranium. Okay. Uranium, of course, breaks down and causes radon. And he wreaks havoc all over the world. And these superheroes, go out and try to stop him from what he does. So we created that. And then the bookmarks, we have it on the front of the bookmarks, and then we explain a little bit about each one. And that went along with it. What we did is we actually took those we actually have them up on portals so people can order them at will. All right. But we'd love to get them distributed. The calendars, we were getting those distributed. The bookmarks went to the libraries and we would put those out there and they would be gone in 60 seconds. We were constantly doing that. So we put them up on the portal and say, if you'd like to order more, please do. We do not, of course, make any money on this whatsoever, but bottom line, it's there for the libraries. Our tools. Then we made a button because all of those superheroes are called the radon rivals. And so the button was, and we put those in the library, and the buttons were created for the kids because then they could put it on and say, I'm a radon rival too. Okay, so we had those. So we did those things and it was a complete success. And it's constant. We've been doing this for, wow, long time. 8 years. 8 years. We have 8 calendars and we have about, it's been about 8 years with the bookmarks as well. So those types of things for the kids. Now, the cool thing about the calendar, just so you know, the reason we did it, and we have inside of there, each month has a challenge also for the kids. So they will go to for the very first one, September, and it's September to August. We did it that way instead of, January to whatever. We did September to August because it's a school year. They would open it up in September. The very first challenge on all 8 of those calendars is go ask your principal if your school has been tested for radon. All right. That's an action item. What is he going to do? He's going to answer him, right? Or he's going to answer somebody. And then that calendar hangs up there on the wall so that, it says that this is what radon is. There's a little thing about radon, and we have a superhero on each one. And then it's hanging on the wall so the kids can say, hey, Mom, Dad, did we test our home for radon? There's always an action item on each one of those. So it's a complete package. And we built those actually for the organization. So that and then after we did that, we created t-shirts and masks because it was during COVID at the time. So we took the superheroes, put them on a t-shirt, then we had a mask. And then the mask can have a superhero on the side too, but they're all customizable and they can be branded with your organization. So for example, if we have a children's hospital that wants to do it, they could do it for Halloween, actually. It would be really cool. Somebody would dress up as one of those superheroes that would have their logo on the shirt. And you go out, and every time you go out, and we're encouraging mitigators to order the shirts, put their logo on, and when they go out and mitigate, wear those shirts. And people will be attracted to what's that all about? Well, radon, da 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 da, but it's fun. And that way you're engaging the children, teaching them more about how they can control their own radon issues in their local communities. So that's what we did. The biggest challenge we have with the entire project is distribution, of course. That's a tough one because to do that on a level, we have to raise grant money or get other organizations to go and order them, and that's where we work the hardest at. So that was our biggest lesson learned, is how can we get this out further. We are trying to work with the children's hospitals, the mitigators and whatnot, businesses, we encourage the small businesses like car dealerships and whatnot. Order 30 calendars and bookmarks and order t-shirts if you want. Get 30 of them, send them to a classroom in your local community. And it's got your logo on, it shows that you're supporting what they're doing. And so that's where we are challenged right now. They want to do it, so we have to keep pushing and pushing. But that's basically what we do, and that's why we have those bookmarks. It has been a success, though. Thank you.
I love your creativity. That's really fun. And your graphics are fantastic. If
Thank you.
people have not seen them, we do have the new bookmark page on LungCAN, so LungCAN/bookmark, and not all of Jackie's materials, but many of Jackie's materials are up there under Radon Resources. So please check them out. Dusty, you have also done this slightly different. What lessons have you learned and what did you do?
Oh, yeah. Thank you for allowing me to share. But I also love the creativity and the different ways that everyone is making an impact for, to save lives. Basically, that's what we're doing, right? By saving lives, by raising awareness about radon. So what we did, my daughter Kimberly and I, we started a program in Harrisonburg, Virginia. And actually, let me go back just a little bit because we got a grant from Genentech for $25,000 to do this radon program in the community. We were initially targeting Pittsburgh, Pennsylvania, and we distributed about 250 radon test kits in that community. But talk about lessons learned. I mean, we were paying, I think, upwards of $15 per radon test kit. And we were going to like health fairs and different activities. We even went to the local baseball game there. Jackie, maybe you remember it's a River something, River Hounds or something?
It's the River Hounds.
River Hounds, right. And people were taking these radon test kits and probably with good intentions, but I don't think they, I think what happened was they had good intentions and they just put it in a drawer or something. And we only got from about 250 radon test kits distributed, we only got about 20 returned. And more importantly, those radon test results, the lab results were on average, I mean, there were a couple that were above the radon action rate of 4 picocuries per liter, but the average was under that radon action rate put out by the EPA. And so the average, if I'm remembering correctly, was about 2.7. So we pivoted and we thought, my daughter Kimberly lived in Harrisonburg, Virginia. We had done a program years before in Harrisonburg and it was incredibly well received. And so we went there and I was there. I stayed with Kimberly and we worked with the local media. We had television and newspaper coverage of the program, which really helped. And we worked with the libraries. This was the great thing because in Pittsburgh, people would be at an event and it might be a health fair or it could be just, an outing. And they weren't necessarily thinking radon, right? They were just there and then they saw radon and maybe they were just being polite and they took the radon test kit. But in Harrisonburg, it was a whole different model. And this model worked so well. Radon in the Shenandoah Valley of Virginia, the EPA estimates it's about 1 in 3 homes have high radon levels. However, our results show that it's probably closer to 50% of the homes. And so we got the word out that we were going to be at the library. The libraries let us have a meeting room. We could meet there for 4-hour blocks. And basically, we just did a continuous loop. We might have one person there. We might have 5 people there, but we just did a 3-minute loop. And in that 3 minutes, we talked about lung cancer in general. I wanted them to know that it was the #1 cancer killer and also that radon was the #2 cause of lung cancer. And then we talked a little bit more about radon, that it like all the things that Rachel was talking about, but we did it very concisely. And then we talked about and demonstrated, we had a radon test kit there and demonstrated how to use it. And we just did this continuous loop of 3 minutes presentation. And more importantly, rather, we had a sheet that made they had to sign the sheet before they could get their radon test kits. And on the sheet, it said, I will use these test kits to test my home within the next 30 days. And by committing to do that, they had a little more skin in the game. But the fact that they made a special trip to the library. They weren't just at an event where someone handed them a radon test kit. They got in their car and they went to the library during these specific hours, specifically to get a radon test kit after reading about it in the newspaper or seeing a story about it on television. So we distributed in Harrisonburg around 400 radon test kits. And we had more than 200, and they're still coming in, but we had more than 200 lab reports. Now, interestingly, the average from all of those, we just did for our report to Genentech, we cut it off at the 200 mark. They were still coming in, but we had a deadline to submit our report. So the average was, I believe, 6.7 picocuries per liter. And we had one that was almost 69 picocuries per liter. So we really were so grateful for the opportunity. So thankful for the support to do the program. We want to do it again. we felt like really incredible. And the community was so appreciative of everything we did. So there's still a lot more work to be done though. But the libraries were, a place where, that's community. And that's where people in the community come, like Lauren said, to get resources, and they trust if people are in the library talking about programs that are going to make their home safer, then they're a lot more likely to come in. So it was really highly successful, and we're just delighted with everything with that program. We hope to do it again.
Fantastic. Well, Allison, I think I'm going to have you take the final lap here. I call you the godmother of the Bookmark Project. I don't know.
Equal recognition on that. Thank you. You all heard a lot about Missouri, so I won't go into a lot of details. But how we got started is because Missouri ranks number 4th in the nation in lung cancer cases. We have high usage of tobacco. 1 in 3 homes have high radon levels, and we have 0 state legislation around radon. So we realized back in 2022, we have a big problem. I met with the American Lung Association and Rachel and an individual from the Missouri Department of Health, and we began to develop the Missouri Lung Cancer Coalition. Because even though lung cancer was a high priority as part of our state action plans, we did not have a dedicated work team. So we created the coalition, and the very first team we established was the radon reduction team. And we began meeting as a group, and our group continues to meet today. And I think that's a really important component if you decide to launch an initiative, whether you meet once a quarter, once a month, to have a working team that's all invested in this has been huge for us. The American Lung Association has been my strongest partner through this effort. We've done a lot with the Department of Health, but then we had 2 of our biggest universities involved too, at Washington University and University of Missouri. So bringing all that together has really helped our efforts. I think that you all have talked about the libraries. The libraries have been huge for us. St. Louis County Library followed up with us after this year's webinar and told us we are one of their most attended adult education webinars that they do. So it's big for them, it's beneficial for them. And we plan to leverage that and use that model that we've done with St. Louis County Library with other big branches across the state. Because if you begin to look at your state libraries, many of them are affiliated under, like St. Louis County Library has 30 branches. So you can tie those all together and work with those groups. I agree with everybody, distribution to the libraries, having them understand what they're getting, making sure you can follow up with them. That has been our biggest challenge too. We've tried everything from distributing through our University of Missouri Extension offices to direct mailing to delivering. We've tried it all. But we have not actually worked through the main central library to distribute those. So we've learned from that. I think we'll learn from you, Mackenzie and Heidi, on that. And I'm also really excited to try some of the things that you all have done for social media. So I think this year we can begin to meet collectively as groups and figure out how to share ideas across our states. I'm excited about it. So thanks, Lauren. If there's anything else I didn't cover, let me know.
Well, we have a question in the chat that have any of you worked with fire departments? They give out smoke detectors. Has anybody tried to see if they would do radon testing?
I have not.
I'm seeing a bunch of shaking heads. I think it's a great idea.
You know what? Gloria Leonard's our founder. She has worked with fire departments and they were handing out test kits at one point and calendars. And we should really get her on one of these just to see how she did it, But yeah, she does that. She also works with her public utility. Every year gets them to put something. They send out a bill or whatever for the her what is it? Is it the Illinois Radon Awareness Act that she got that? But anyway, it's about testing. And so she does this every year, and she gets them to put something in their utility bill. So there's
Lauren, I kind of agree with Dusty though when she said too, we in the early years gave out a lot of test kits that were not returned.
oh yeah.
We have found some pretty high success of We offered through our webinars, if people attended the webinars, they could click on a link that would take them to request a test kit. I think that was a little bit more successful because they were invested. They had attended the webinar, they learned about it. And Rachel, I know when we did the survey results from people that attended a webinar, a lot of them said they knew about radon but had not taken action, but as a result of the webinar, they would take action. So I think having kind of a hook before, because I've given out so many at health fairs and stuff that never came back. They had good intentions, but they weren't returned.
I want to quickly go back to our PowerPoint and just mention that, overall, I think you heard the lessons learned are start small and build momentum, engage your partners early. Libraries are strong community partners. We heard that a lot. And simple tools can have a broad impact. And it's really about collaborating and sharing resources. We can reduce the risk for lung cancer for all communities. I know in the Portland area, we have 1 in 3 homes are at risk of high radon. So super important. We have put together all the tools you need. They are at lungcan.org/bookmark. We have a detailed playbook, step-by-step action, how you launch this, templates, webinar templates. We have sample flyers, sample bookmarks. It's all there. And please use those resources. And this is all of our contact information. If your state's going to be next, please let us know how we can help. Please join us and let's all work together to eliminate radon risk in America for lung cancer. It's really a sad statistic and one that I hope that is modifiable and we have answers for it. So, it's really important that we work together to make this change. So thank you everyone for attending and thank you to all of our speakers today. Really fantastic work. I can't imagine how many lives you've saved. And you should all be so proud in just how many lives you have saved. Just saying thank you all. You all are fantastic. Really appreciate everybody and the work we're doing. And together, we can make lung cancer history. I mean, we can change the outcome of this disease. And so thank you.